It's a story that no expecting mother ever wants to experience. An injury during childbirth so severe that it changes life forever. A 32-year-old woman has taken her former gynecologist, Dr. Koo Chung-kiat, to court, alleging that medical negligence during her delivery at Mount Elizabeth Novena Hospital in 2020 resulted in a debilitating condition known as a rectovaginal fistula. This condition, where bowel contents pass into the vagina due to a tissue tear, has left her battling physical, emotional, and psychological scars. Welcome to 2230. If you find value in detailed, investigative news coverage, make sure to like this video, subscribe, and turn on notifications. We're pushing towards 11,000 subscribers, and your support means everything. Now, let's dive deep into this shocking case and the legal battle unfolding in Singapore's High Court. According to reports, the woman gave birth to her first child on May 3, 2020. She claims that Dr. Koo failed to inform her about a severe vaginal tear before stitching it up. More critically, she says he did not advise her to consult a colorectal surgeon, which could have led to earlier intervention. The consequences were devastating. She suffered months of fecal discharge from her vagina and menstrual blood through her anus, a horrifying reality that no mother should have to endure. She now argues that this injury has profoundly affected her life. She experienced postpartum depression and PTSD, struggled to bond with her child, and has lost the ability to give birth naturally. Beyond physical damage, she claims it has diminished her libido, altered her personality, and even changed how she perceives children. The mental and emotional toll has been immense. But was this truly a case of medical negligence? That's where things get complicated. Her lawyer, Kamara Kamalakumar, contends that an emergency C-section should have been performed given her slow cervical dilation. At one point, she even messaged Dr. Koo, highlighting that her mother had experienced similar difficulties, requiring a C-section. Initially, the doctor agreed to the procedure, but she claims that he later changed course, manually dilated her cervix, and proceeded with a vaginal delivery instead. Dr. Koo, on the other hand, denies these allegations. His legal team, led by senior counsel Kua Boon Thang, argues that the tear naturally broke down into a fistula and was not the result of medical negligence. He insists that he handled the tear appropriately, informed the patient, and referred her for specialist treatment when necessary. With obstetrics, gynecology, and colorectal experts testifying on both sides, this case could set a major precedent for obstetric care in Singapore. How much responsibility does a doctor bear in unpredictable childbirth complications? Should a C-section have been the preferred option, or was a vaginal delivery within the standard of care? This case isn't just about one woman's trauma. It raises bigger questions about patient consent, medical transparency, and maternal rights. How much information should doctors disclose to expectant mothers? Should hospitals revise childbirth protocols to prevent similar tragedies? As this legal battle unfolds, what do you think? Should doctors be held more accountable for childbirth injuries, or are such complications an unavoidable part of the delivery process? Share your thoughts in the comments, and don't forget to like, share, and subscribe to help us bring more in-depth news to you. 2230 will keep you updated. Stay tuned.